Senior Resident of Internal Medicine at the All India Institute of Medical Sciences in the capital, New Delhi. Good to have you on the show. With the Omicron variant being more transmissible than previous strains, this is definitely posing a new challenge for the entire country.
Yes, definitely. It is a very new challenge, though it have like a newer variant is showing a very less virulence, and it is not showing like a serious cases. Till now, we are only seeing milder cases only, but definitely it is a very serious threat to the nation. As in the second wave, we have seen there is so many deaths and there is total collapse of healthcare infrastructure. So that's why this time even the government is very serious, and they have imposed like in many of the states the night curfews were imposed, and our prime minister day before yesterday announced a booster dose, that is a third dose of vaccine, to all the healthcare workers and the elderly above 60 years of age. And they have also extended the age group of vaccination from to adolescence age group, like from 15 to 18 years of age. Till now it was only available above 18 years of age. So there were many proactive measures was taken where looking at the seriousness of the infection, because the infection is definitely a threat, and if it occurs same as it happened last year, then it will be a very difficult situation for India.
Harjit, you say that the government is taking this seriously, but let me remind you, during the previous Delta wave, we all saw how much the country struggled. How prepared is India to deal with what some rich Western countries are describing this Omicron spread as a tidal wave?
Obviously, the preparation is like a large country like India. Whatever preparation you do, we can't be up to the 100%. But there are few measures was taken, but still there is needed. Like we were expecting that more and more testings, isolation, the same old criteria to stop the chain of transmission. That pattern should be followed. That is not followed till now, and again there is no such measures was taken to increase the infrastructure. And unfortunately, I also want to add on that there are thousands of doctors who are protesting on roads to because they want to join their duties, but their counseling was not held, and they are now on roads asking the government to have to conduct counselings, but the counseling was not done, and so that the manpower in the hospitals was also very less, and it can also result into a enhanced crisis situation. So more measures should be taken, and I hope that in coming time, as the Omicron is rising, so we will see a more measures will be taken.
Let's talk about those more measures. What do you think the country has learned after the Delta variant, which can be implemented in this era where we're seeing a rise in cases?
Uh, Mostly now what we are seeing that the government is imposing more on and emphasizing to the people to follow COVID appropriate behavior, which is a very important thing. Second thing they were doing, like imposing though they started with the night curfews, but if I think more measures may be needed, then they can also make the containment zones and everything which can be seen. So currently we are seeing a very early form of Omicron. So that's why we are not seeing that much measures. But as the wave will follow, then we are hopeful that some new measures will be taken.
Harjit, thank you very much. Harjit Singh Bhatti, live for us from New Delhi.